So in a boxing match, this guy got hit on the right side of his face, as you can see here. He lost his consciousness momentarily. Now the patient is conscious and oriented. So the patient is having muffled hearing, but he's otherwise normal. On examination, cervical spine is normal. Otoscopy reveals hemotympanon in the right ear. There is a blood in the tympanic membrane of the right ear. What nerve is at great risk of injury? So first of all, if you see a hematympanum in the right ear, you are concerned about what? You're concerned about temporal bone fracture. Temporal bone fracture will injure which nerve? So the answer is 7th cranial nerve, which is the facial nerve. Okay, so the first nerve that can be injured is the facial nerve. The second nerve that can be injured is the 8th cranial nerve, because it also travels through the temporal bone. So any fracture of the temporal bone, so either a 7th cranial nerve or the 8th cranial nerve, and most commonly is the 7th cranial nerve more than the 8th cranial nerve. So as you can see, this is the facial nerve. So the facial nerve comes from the brain stem and then enters the internal auditory meatus, as you can see here. And note that the internal auditory meatus is part of the temporal bone. So the whole thing is the temporal bone. And this is from the inside. Also note that the facial nerve is traveling inside the internal auditory meatus with the 8th cranial nerve, which is vestibular cochlear nerve. However, the facial nerve continues through the middle ear, as you can see here. And you can see here it's this is the facial nerve, and then through the mastoid portion to exit this canal, which is called stylomastoid foramen. As you can see here, this is stylomastoid foramen. So in simple words, any temporal bone fracture, risk of injury to the facial nerve and vestibulocochlear nerve, because they're both present within the temporal bone, especially if the patient got hit to his face and there is hemotympanon, which could indicate that there is a fracture in the temporal bone. Other structures that we also find in the temporal bone, so first of all, external auditory canal, then tympanic membrane, then ossicles, incus malleus stapes, and then cochlea, and then both the facial nerve and vestibulocochlear nerve. So any of these structures could also be injured if there is a temporal bone fracture. The clinical picture, if it's related to the, for example, external auditory canal, tympanic membrane, ossicles, and cochlea and vestibulocochlear nerve, the patient will have a hearing problem. If it's the facial nerve has function on the eye, in the mouth, and inside the ear. So for example, for the eye, it close your eye and make you cry. So it gives innervation to the lacrimal gland, parasympathetic innervation for lacrimation, and also closes the eyelid. For the mouth, for the tongue, anterior 2/3 of the tongue, taste. And also, second function, it gives parasympathetic innervation to the submandibular gland, parasympathetic innervation for more saliva. So this is for the eye, and this is for the mouth. For the ear, it innervates a muscle which is called stapedius muscle. This muscle dampens the sound so that you do not hear everything loud. This is like decreasing the volume of the sound inside the ear. Otherwise, if there is dysfunction, you will not be able to sleep at night, because you will be able to hear your heart sound, for example. Hear every noise, every small noise will be loud noise. Okay, and the last function, so we talked about the eye, we talked about the mouth, we talked about the ear. The last function of the facial nerve, and it's called facial because it goes to the face and innervates the facial muscles of expression, and there are plenty of them. They are innervated by the facial nerve. So if you're making funny faces, this is because of the facial nerve. Thank you very much. I hope that was helpful.